There's a lot of concerns about people's health and safety this time of year as our kids and students start heading back to school. So today, let's talk about the effects of the Delta variant. Well, if you have been following the news and doing any reading at all about the Delta variant, you will hear doctors and researchers talking about whether the Delta variant is causing more illness in children than the Alpha variant. And of course, the Alpha variant was the first COVID-19 virus that we dealt with. In my opinion, adults as well as children are being significantly affected by the Delta variant. Let's look at some facts. During the week of August the 15th, there had been 121,000 new child COVID-19 cases. That was a spike of over 300% in the prior month. In kids less than 12 years old, there has been a dramatic increase in cases, 80 to 90% versus the Alpha variant. In Nashville, some 1,000 students are now in quarantine or being isolated. In Florida, as we've heard, one school district has some 8,000 students in quarantine or isolated. While kids were less likely thought to be affected with COVID and die, the numbers are trending in the opposite direction. While it's thought that most kids don't easily get sick, those that do are fighting for their lives. So the question is, as parents, what can we do? What do we tell our children? Because the vaccine for those less than 12 years of age won't be available until the end of this year. Maybe. Parents, first we must get vaccinated. We must vaccinate our children who are 12 years of age and older, and also try and make sure our kids are not around unvaccinated people as much as possible. 9 million teens have received the Pfizer vaccine with very, very rare side effects. Myocarditis, as we talked about in a previous video, occurred in about 4% of the vaccinated teens with very, very mild symptoms. And when it comes to vaccine side effects, especially in a time like this, looking at the risk versus benefit, there's a lot of benefit extremely outweighing being infected by the virus. To date, there's been 4 million cases of COVID in kids less than 19, and 4% of those have ended up in the hospital. The risk of developing myocarditis/pericarditis with COVID infection is much higher, and symptoms can be much worse. Even now, children are developing long COVID, aka long haulers disease. Per the American Academy of Pediatrics, these are some of the things that they have recommended strongly that we do. Kids less than 12 years of age should wear a mask when inside. Make sure you talk to your kids about proper hand washing and hygiene. Ask about the ventilation in your child's classroom, really important. See if kids are being taught in pods or in small groups. Are they just randomly running around like pre-COVID? I think you should get a certain feel when you go to your child's classroom. Are the kids being strongly encouraged to practice social distancing? And we know that the CDC's recommendation was 3 feet distancing with the kids. I think you owe it to your child and yourself to visit the school and see how things are set up. We have to remember children have mostly avoided the worst of the COVID pandemic, but with this Delta variant, there is the concern the virus is and will continue to spread among younger children and cause more inflammatory symptoms. The big issue is that children under 12 years of age do not have access to the vaccine, so this makes them very vulnerable. If we leave out a significant percentage of the population from getting vaccinated, coupled with those who choose not to be vaccinated, it will spread quickly. I know people are concerned about adverse side effects. Also, people are concerned about long-term side effects. Going back over 100 years of vaccines, if you are going to see side effects from a vaccine, and we have taken many vaccines, you will see these side effects within the first 6 weeks. And now for people who did take the vaccine, we are months down the road without any damaging adverse problems. And remember, that is after 160 to 170 million dosages of the vaccine. With the focus back on the kids, let's not forget about the influenza vaccine or the flu vaccine. Please make sure to get your child the influenza vaccine. And also remember, this Delta virus represents or presents like the common cold, which means high fevers, coughing, shortness of breath, runny nose, typical cold symptoms. So that's going to make it even more complicated when your child comes home and they have these symptoms. If you have any reservation or thought that they may have contracted the Delta variant, get them tested. There are a lot of things we can do for ourselves and our kids, which includes drinking lots of water, vitamin C, vitamin D, zinc, eating plenty of fruits and vegetables, just making healthy lifestyle choices for our children. Even getting yourself on a good sleep regimen and trying to live a well-balanced and stress-free life will help. And also remember that they are finding that there are children that do have underlying conditions such as obesity, asthma, just to mention a few, that do worse when they're hospitalized. So if your child has either of these or any underlying condition, really pay close attention and make sure you're doing all the things to help them to be healthy. As always, the topic of COVID is ever changing and constantly evolving week to week. So be sure to subscribe and you can follow along as we continue to put our weekly updates. Please like this video if you found it helpful. It really helps us out. And we'll see you next week. Have a good week.